Hi, everybody. This is Ariana Anderson. I'm a traditional naturopath here at Anderson Family Chiropractic and Naturopathic Care. We're going to talk a little bit about mental health and how to support it naturally today. I'm going to share my screen real quick like. Just going through a quick disclosure at the beginning. This video is for educational purposes only and is not intended as a substitute for individual diagnosis and treatment by a qualified healthcare provider. Communications by Anderson Family Chiropractic and Naturopathic Care are on our online platforms are not privileged communications and do not create a doctor-patient relationship. So we're going to talk a little bit today about mental health and how you might be able to support it naturally and holistically. Kelly Brogan, who is a medical doctor, has been quoted as saying the best way to heal the mind is to heal the whole body. And that is true. Depression is a symptom. It's not really a disease. It's a pathological response to stressful situations in the mind and or body. What are health factors in a depression epidemic? So sedentary lifestyle, which a lot of Americans have, unfortunately. It's just kind of the nature of our jobs nowadays. Inadequate nutrition. I think that most of us growing up here have had series of times in our life where we've maybe not been putting the best fuel in our body. Unrelenting stress, that can be, it's not always physical stress, right? A lot of it is mental, emotional at work or at home or wherever, especially when it's chronic and it doesn't go away. That can lead into depression. And inadequate sleep. So what is the common factor? Really, it is higher levels of inflammation in the body, especially systemically. So in a depressed person, the systems within the body, which are interconnected, are not in balance. So such systems as blood sugar, cortisol dysregulation, gut health, thyroid function, and with inflammation being present at each level of the dysfunction. So let's talk a little bit about stress. I think this is something that most people are dealing with, and really stress can be very helpful and healthful if it's done in the proper way and not chronically. So prolonged stress can actually cause chemical imbalances of the nervous system, hormone, and immune system. Stress can deplete neurotransmitter stores faster than they can be created, which can result in a deficiency. And when the endocrine system or your hormone system is overstimulated by stress, cortisol, which is your stress response hormone, is released, but it can trigger inflammatory signals in the body, traveling to the brain and priming it for hyper response when we're having chronic prolonged stress. So let's talk a little bit more about cortisol. People who are depressed typically have elevated levels of cortisol, which can lead to one, problems with glucose or blood sugar metabolism. That's pretty common. Increased insulin resistance, which can lead to an accumulation of belly fat. That's pretty normal. A lot more people are becoming aware of what's called metabolic syndrome, and that is sort of a spectrum of all three of these things happening in the body. And sometimes it can be just like a limited amount. Sometimes it can be quite a bit where they become very insulin resistant and there is a lot of fat accumulation in certain parts of the body. But there's definitely a blood sugar connection to depression. So women with diabetes are 29% more likely to develop depression. Women who are taking insulin are 53% more likely to develop depression. Women who are depressed are 17% more likely to develop diabetes. And women who are on antidepressants are 25% more likely to develop diabetes than counterparts who are not depressed. So you can see that there is a cyclical nature there. There definitely is a connection. People whose blood sugar is on the high end of normal range have a much greater risk for brain shrinkage, which is known to be a contributor to brain disorders and dementia. And you can see some of the, at the bottom here, some of the research that you could maybe go in and look at if you're looking for a little deeper dive on that. So Dr. Mark Hyman is a medical doctor, head of functional medicine at the Cleveland Clinic. He's been quoted as saying, "The evidence is in, sugar causes inflammation. The insulin-resistant fat cells you pack on when you eat too much sugar produces nasty inflammatory messages, which are called cytokines, spreading their damage to the brain. In fact, researchers have suggested calling depression metabolic syndrome type 2, because instead of just having a fat, swollen belly, you will also get a fat, swollen, and depressed brain." And psychiatrists are starting to treat depression and psychiatric disorders with anti-diabetic drugs like Actos. These drugs lower blood sugar, lower insulin, and produce inflammation. Well, I would say, and I think Dr. Hyman would say as well, that there are other things that we can do before we start to do drug treatments. There's a lot of other things that we can do to bring in and decrease some of this inflammation naturally. So B vitamins, super important. Most people are pretty deficient in these. Folic acid and B12 are actually precursors to the formation of all neurotransmitters. So everyone needs to have folic acid and B12. Also, B vitamins, especially folate, carry and donate methyl groups to the brain for neurotransmitter formation, such as serotonin, epinephrine, dopamine. And think of those like dopamine and serotonin. Those are going to make you feel. They're going to make you feel better, happier. And they have also found that B12 deficiency itself can actually cause depression. So need to make sure that we're getting in good whole food B vitamins, not ones that are necessarily isolated that you get like from the local store. You're going to want to get them from actual food. You'd be surprised at how B1 is actually created in an isolated form. There's actually coal tar involved in that. So you want to make sure that when you're getting these B vitamins, they're coming from a whole food source and not from an isolated source in a lab. So let's talk about food allergies. Most people don't think about that in relation to neurochemistry, but it actually plays a pretty big role. So David Perlmutter, who is a neurologist, has been quoted as saying, "What we now call wheat bears little resemblance to the wild einkorn or single grain variety that our forebears consumed on a rare occasion. With modern hybridization and gene modifying technology, the 133 pounds of wheat that an average American consumes per year shares almost no genetic, structural, or chemical likeness to wheat that the hunter-gatherers might have stumbled upon." So it's different. And it's not just a gut problem, unfortunately. So we're going to talk a little bit about a couple quotes from a couple doctors that study this in depth. The first is Professor Marios. I'm not even going to try to say his last name, but he is from the Royal Hallamshire Hospital in Sheffield, England. And he has stated, "Our data suggests that gluten sensitivity is common in patients with neurological disease of unknown cause and may have etiological significance. Gluten sensitivity is best defined as a state of heightened immunological responsiveness in genetically susceptible people. This definition does not imply bowel involvement. That gluten sensitivity is regarded as principally a disease of the small bowel is a historical misconception." A lot of times when people think about gluten sensitivity, of course, we think of like IBS or, when people have issues with their bowels. But they have found that people that have issues with gluten do not always have bowel issues. Sometimes the issues that they have are neurological in nature. Also, Dr. Rodney Ford, who is with the Children's Gastroenterology and Allergy Clinic in New Zealand, has said, "The fundamental problem with gluten is its interference with the body's neural networks. Gluten is linked to neurological harm in patients, both with and without celiac disease. Evidence points to the nervous system as the prime site of gluten damage," which is very interesting, right? I think that most people are pretty shocked when they hear this. And Dr. Ford estimates that 1 in 10 people are negatively affected by gluten. So why? Good question. There is a protein in gluten called gliadin. And if that protein is broken down and gets into the bloodstream, it can actually cause your body to start making antibodies. And that happens due to leaky gut, which some of you may be familiar with. And if you're really interested in learning more, I have a really good lecture on our YouTube channel about food allergies. But essentially, you have an antibody that combines with the gliadin protein, which creates an anti-gliadin antibody. And specific genes are turned on in a special type of immune cell in the body. Once these genes are activated, an inflammatory cytokine chemical collects and can attack the brain. And this is how gluten can cause issues in the brain. Not to mention with inflammation in the gut, there is a whole nervous system connection between the gut and the brain, which can be communicating that there's fire in the gut, right? But so this is in addition to that. This is an antibody specifically created for this gliadin protein that can attack and cause issues in brain cells. So anti-gliadin antibodies combine with specific proteins found in the brain that look like gliadin proteins found in gluten-containing foods, but the anti-gliadin antibodies can't tell the difference and can attack those brain proteins. And unfortunately, gliadin antibodies typically have a half-life of about 120 days. So what that means is those antibodies stay in your body for an enormously long time, anywhere from like 6 to 8 months. And so to clear them is a lengthy process. So what are some of the symptoms of gluten sensitivity? You can see right here, ADHD, epilepsy, seizures, diabetes, anxiety, lack of balance, insomnia, autoimmune, joint bone pain. That's actually, joint pain is very common. Brain fog, migraines, obesity, delayed growth, depression, digestion, Tourette's, mood disorders, memory, irritable bowel, malabsorption of nutrients, and neurological disorders. So where is gluten? I mean, most people know that gluten is in wheat, but unfortunately, it's also in a lot of other things too. So barley, bulgur, couscous, farina, gram flour, kamut, matzo, rye, semolina, spelt, and obviously wheat. But did you know that it's in some chocolate milks? It's in a lot of sauces. It's in a lot of marinades, ice cream, gravy, egg substitutes, cold cuts, in many of bouillon spices, beer, ketchup. It's in some mayonnaises, syrups, trail mix, tabbouleh, sausage. I've seen it in beef sticks. So why would they put bread in our beef sticks, right? Well, it's because gluten is a really sticky substance and it's a good binder. So they'll put it in these things to try and keep them together because it's cheap and it's effective. Unfortunately, it's also hard for a lot of people to digest and it causes problems. Also, I do want to talk, I would be very negligent if I didn't talk about sleep. An inability to sleep is one of the key signs of clinical depression. Another sign of clinical depression is sleeping too much or oversleeping. So I can't overemphasize the importance that we get good sleep every night. Neurotransmitters are natural chemical messengers in the nervous system that send signals from one nerve cell across a synapse to another nerve cell or target organ. And so serotonin plays a role in sleep, mood, intestinal function, pain control, and inflammation. And so it's super important that that is being produced properly. Dopamine plays a role in cognitive function, memory, learning, and pleasure. It acts actually in the pineal gland, which is central to dictating the circadian rhythm in humans and a series of biological processes that enable brain activity to adapt to the time of day, and that is light and dark cycles. And so these things oftentimes are made during sleep cycles. And so if we're not sleeping well, we're really not going to be able to create these really important neurotransmitters. And there's a lot of things that you can do to help support that. And any of our patients here, please just give Dr. J or I, and just let us know if you're having issues with sleep. There's a lot of things that we can do naturally to help support that. So here's some of the specific ones that we've used in the past. We actually do have combinations of these in the office to help people. So we have some mainly GABA, L-taurine, L-glycine, and 5-HTP, but also keep in mind vitamin B5 and B6. Those things are actually incredibly important as well. And of course, getting them from whole food sources is the best. So another thing that can be really helpful from an herbal perspective is using adaptogens. And it's interesting, during the period of 1950s to the 60s, the idea of using herbal medicines, medicinal plants to increase stamina and survival in harmful environments was developed mainly with soldiers. And so this new concept of an adaptogen was introduced by a toxicologist by the name of Lazarev. And he described the compounds which would increase the state of nonspecific resistance and stress. And so basically what this slide shows you is if this blue line is a stress response right here, with certain adaptogenic herbs, it helps bring it into this pink sort of calm state. One of the adaptogenic herbs that we have used in the office quite often is ashwagandha. It's super effective and fun to say. So anyway, any of our patients that are having issues with, maybe a nervous system cycle, kind of like this blue line, let Dr. J or I know, and we can make some recommendations on any of the various adaptogenic herbs. There's several. That one is just the most common and easy to get. So when it comes to mental health, there's oftentimes this sort of pyramid here, this like cycle that kind of goes downhill over years and decades. So let's say someone in their teens starts to have symptoms of mental health dysfunction. Say, it's not that much, but let's just say we're losing maybe we're running at 90%. Well, the more often and severe the symptoms, the more stress on the organs, which uses up more vitamins and minerals, which is going to lead to a little bit of a deficiency. Maybe it's only 10%, but unfortunately, vitamins and minerals fuel our organs, which is going to leave us with some organ dysfunction. Again, maybe they're operating at 90% when we're a teenager, not so bad. But unfortunately, when our organs are not working 100%, it decreases our ability to absorb, digest, and utilize vitamins and minerals, which leads to what? More mental health issues, right? Which is going to bring us down a little bit. Maybe it goes down to, 80%, 60%, 70%, whatnot. But if you do that over the years and decades, what ends up happening? Then we start to notice that we've lost a significant amount of organ function. And we're having a really difficult time with managing the symptoms. This doesn't happen overnight. This happens over a long period of time. When you start to have big dashboard lights, like some of those symptoms we were talking about earlier, that usually means that this has been a problem for a while. So of course we need to stop that cycle, right? And so how we help, at least on the health and wellness side of things, is with every system imbalance, there is going to be a nutritional deficiency and some type of organ dysfunction to some degree. And so we need to halt these vicious cycles to prevent further damage. And so we help to support and enable the body to stabilize and improve. And so how do we do that? So on my side of the shop, on the wellness side, we help you find out what specific vitamin or mineral deficiency that you have. We help you find out exactly what organs are already being affected and then fix and handle them once and for all. So I use, my primary modality is using nutrition response testing, which is a form of applied kinesiology. And if you're really interested in learning a little bit more about how we can design clinical nutrition programs for you, feel free to go down to, I will put a link in the comments as well, but go to our YouTube page. It's called AFC Wellness and Chiropractic Care, and then go scroll to the Nutrition Response Testing Explained. I think it's actually AFC Nutrition Response Testing Demonstration. And you'll see me and my assistant Tori giving you a real brief explanation of the technique that we use that has become very, very effective with the people that we work with. And if you are interested in learning more, you can call or email our office for a consultation. Our phone number at our office in Waterville, Ohio is 419-878-8312, or you could email us at afcwellness@hotmail.com. And again, thank you for coming out. We always appreciate people that spend a little extra time to learn a bit more about their health and how to support their healing and naturally. And I hope you have a great day.